The display in the air aircraft will not be allowed to land at the Abuja airport within that moment. The Kaduna State Primary Health Care Board, in collaboration with the United Nations Children Fund UNICEF, have organized a media workshop with journalists and social media influencers on the need to enlighten the public and the elite households on the importance of immunization. Correspondent was there and now completes the report. In a renewed push to safeguard Nigeria's polio-free status, health authorities in Kaduna State are rolling out a focused strategy to tackle vaccine resistance among affluent and educated families, a group increasingly identified as a weak link in the immunization chain. The Kaduna State Primary Healthcare Board is shifting from broad public awareness campaigns to a more personalized door-to-door approach. Specialized teams are now engaging directly with elite households in urban centers where misinformation, often spread online, has fueled skepticism about the polio vaccine. This strategic pivot comes amid a sobering warning from the United Nations Children's Fund UNICEF, which cautions that Africa's hard-won progress against polio remains precarious. Although the continent was declared free of wild polio virus in 2020, the threat of outbreaks from vaccine-derived strains and cross-border importations persist. Speaking during a media parley on the upcoming polio campaign in Kaduna, Ibrahim Adamu of the Kaduna State Primary Healthcare Board Immunization Office confirmed the new approach. He emphasized that the initiative is designed to boost vaccine uptake and shield children from preventable diseases, especially in communities where resistance is growing.
So if we have any pending child, we actually no relent. We devise different strategies to ensure that those children that were missed were reached with the oral polio vaccine. We are now planning to have a November round, which will be implemented in December, the first week of December. That's from 6th to 9th of December.
Also, Dr. Isa Yushau, the board's communication officer, explained that the agency is adopting a case-by-case model to address vaccine hesitancy, particularly among families with children in private schools, a demographic that has shown increasing reluctance to participate in immunization drives.
You know, media people are part of our key stakeholders who help us in disseminating information to, the caregivers and our target audience. And we have seen the role of media in our previous campaigns, and that is why when we were having this last lap of the polio eradication campaign for the year, we saw the need for us to engage the media.
Adding his voice, Ibrahim Muhammad, social and behavior change specialist at UNICEF's Kaduna Field Office, warned against any relaxation in efforts. He said now is the time to step back because complacency could lead to a devastating resurgence of the virus.
We have remarkable achievement in terms of uptake of measles, rubella, polio vaccine. Of course, the campaign was one huge campaign in the history of Nigeria, where about 106 million people across Nigeria were targeted. Of course, under 5 children were targeted, and of course, people below the age of 14 too were also targeted.
As Kaduna intensifies its campaign, health officials hope that targeted engagement will close immunization gaps and keep the state and the country firmly on track towards a polio-free future. The Kano State government has called for the immediate investigation